Hello, everybody. It's Dr. Becker again. You've made it to week 14. Yay. I know you guys are probably very much done with hearing my voice. So let's kind of plow through this. Okay, we're going to start hitting on a couple of the things that are just important for you in general to talk about as APRNs. It's a little bit outside of leadership realm, but this is a chance for us to have you in a class to talk about some of these things like marketing yourself, reimbursement, some of these things, again, in a little bit more detail that I think is helpful. I continue to use the Hamrick and Hansen's Advanced Practice Nurse part here as well. Okay, let's get started. First, we're going to talk a little bit about marketing yourself, negotiation contracts, kind of skim the surface, because I want you to have this knowledge now to start thinking about it as you're already making connections within your healthcare systems. Maybe you're already kind of thinking about where you want to have a job. Maybe you're in a clinical environment and they start to approach you about some of these things about maybe hiring you after school, etc. Talking to your preceptors about this as you move into diagnosis and management next semester, those kind of things. So when we talk about, first of all, is finding a good fit. There can sometimes definitely be a pressure just to take the first job that comes because you're scared you're not going to get employed and you're like, I need to work and make money and my life needs to move on past school. But finding a good fit is really important. So satisfaction, obviously, is when you have a right match between you as a person and your work that you find. Adaptability is very important when we talk about finding a good fit as an APRN. Adaptability to a changing healthcare marketplace is a great strength. As an APRN, you're participating in both clinical and administrative processes and practice settings. Examples of the indirect processes could be steps taken to register a patient, collect their demographic, to maybe you have to do your own billing, maybe you have to worry about your own safety reporting, maybe you have to work with office supplies and vendors. So being aware and adaptable to all these things that may come into practice is really important. Both direct and indirect processes are essential to managing the healthcare system. So you may be more affected or not, depending on if you're in a small area or a much bigger practice area, etc. Self-assessment clarifies personal and professional values, which is your philosophical basis for practice, and you're trying to decide if you want more of an intrapreneurial or entrepreneurial approach. At any given time, you may have to adopt either. Sometimes it's a mixture. Remember, an entrepreneur plans, organizes, operates, and participates in the healthcare delivery organization. Entrepreneurs have control over and responsibility for an increased proportion of the indirect processes of care in their roles compared with people that are intrapreneurs. And there's more risk associated with what you're doing. An intrapreneur participates within already a developed framework or program. When we talk about your philosophical basis for practice, it's these questions. What type of nursing practice or approach to care delivery best describes how you perceive your own nursing practice? What do you value the most? Do the options that are given before you favor this philosophy of yours? And if not, how big of a problem is it for you? If you're trying to decide if you're worth kind of going out on your own or staying within a health system, do you thrive on risk taking? How is loss or being unsuccessful defined? If you like to take risks, how much of a loss can you afford to take both professionally and personally if the ventures prove unsuccessful, etc.? Let's review. Entrepreneurship is employee of an organization. You will assume a role to develop new ideas and establish organizations. You have to have a little bit of flexibility within that as well. Entrepreneurial, right? Maybe you're paid by the hour or project. You can choose your work amongst what you find to be most meaningful. You set your own hours, terms, conditions, but you need to be able to build strong reputation and cultivate your mastery as a clinician. You maybe don't have benefit or malpractice coverage right away. DNP prepared APRNs are positioned to identify opportunities and gaps in service. Experienced APRNs may also pursue opportunities or work environments to make a difference. So it could be maybe at some point when you're more experienced, or maybe if you go on to be a DNP, you may feel more prepared to take on an entrepreneurial type of employment. APRNs are better prepared to pursue innovative solutions to improve healthcare outcomes. So there is a large void, if you will, to be filled by people who are willing to go out and be an entrepreneur into the healthcare arena. Entrepreneurial success because of acquired expertise and skill acquisition through education and consultation. APRN challenge or can help create, they rise to the challenge of being innovative in practice. But there's also things like, are you business savvy? Are you good with finance and regulation, etc.? What are your stakeholders? What do they think? How can you work this business? When I graduated, 2 of my APRN fellow students went into business right away as brand new acute care graduates and opened up their health at home business as APRNs. And they did like a medical home care, hospital at home based model for people fresh out of the hospital to be consulted. They had no idea what they were doing, but they very much were open to the risk. They had money between themselves personally, and they went out and created a business. They jumped right into figuring out regulations and licensing and then whatever, and they're still in practice 20 years later. Same business, and it's doing very well. They have like 100 employees underneath of them, and they've created this business. The thought of doing that, to me, makes me want to vomit. I am not a risk taker that way, nor would I want to be in charge of all of those administrative things and having people depend on my business savvy to get a paycheck. But if that is something that you feel you want to explore someday, there is lots of room to be an entrepreneurial person in the APRN role. As a new APRN, marketing is an important way for APRNs to achieve stature as principal players in the healthcare arena. Essential for you as an APRN to integrate clinical expertise, leadership, collaboration, all your competencies, as well as business skills. When I took up the position in cardiology, I was greatly surprised that they didn't market me. They had no plan for marketing right away. And when I brought this up, they were like, "Oh, this is a great idea." They were kind of between, the marketing team was, new people. And it greatly improved our business when they put me out there as a female, as an NP being added to this practice. It did expand. We did boom. People wanted to see an NP, wanted to see a female in our community. So there was a marketing part there. And my job was not going to be successful if I wasn't able to market myself. So marketing is a really important skill that you will have impacting your career, especially if you change positions. So if you are a new graduate and you're in a facility, that is something you could talk about. Am I going to be marketed? How are you going to bring in business? Especially if you ever find yourself in like an RVU-based job or a paid for performance or a bonus structure, right? So if it is, you have to see 20 patients a day in your outpatient heart failure clinic, well, then how are you going to help market me so I can hit that goal to get my salary, right? So marketing yourself is something that will be involved in your business to some degree. And for many of us, this is a new thing and quite uncomfortable. Professional networking, marketing through membership in local and state national organizations, attendance at your local APRN meetings, identification of clinical strengths, work values, interests, professional goals, those things. It is huge to network and to market yourself. Number one, you're also creating a network of others to lean on and ask opinions on. But it's also, if you ever needed to change jobs, you can reach out to the network of people. Hey, do you know of anybody hiring for me in where you are, or those kind of things? Absolutely. So these are all important ideas to network. There's a lot of web-based resources and professional recruiters. I would not shy away from exploring the idea of a recruiter if you don't have great networking connections as a student. I'm not saying everybody has to have one, and there's definitely positives and negatives, but I would just say I wouldn't shy away from exploring that idea if that was something needed, right? Because there are many interesting jobs that are out there that use recruiting to find people to come and apply. I also want to kind of throw out here now some of this idea of professionalism as a concept for y'all to be thinking about. And one of the things they talk about here is keeping personal social networking sites reflective of your professional values. And so when you do go to interview and whatever, you can guarantee that they are jumping on Facebook or Instagram or whatever and searching for you and seeing if even your social platform is something that they would want to be associated with. So this is also part of your networking, something to kind of throw out there a little bit now. All right, communication. Your written and verbal communication skills are very important, and your tone of communication should be professional at all times. And this is something that you should start now, okay? Consider yourself an APRN professional now. So it is really hard when we are used to text messages and just kind of living in this digital world where we don't even use correct grammar half of the time. I would challenge you guys now to, if you're sending emails to your preceptors, if you're interviewing, anything that you are doing now, start being professional in it. The tone is very important. And you guys know it is incredibly hard, or I should say, it incredibly limits effective communication when it's not in person. And it's even more hampered when it's written because you don't have tone of voice and you don't have body language. So stop and look at any email, text message, or anything that you send, right? It should be professional. It should be spelled correctly with correct punctuation, always. Any email you fire off at a work or a job as a professional now as an APRN should be a professional tone at all times. When you go to interview, experts are always going to recommend using a cover letter. These are things I would talk about now with your preceptor. When you're out there, ask them, how did you apply? What kind of cover letter? Did you take a class? How did you come to write that? Do you have any tips or tricks, right? Pick the brains of the people that you're working with. A cover letter describes your qualifications, your interest in an organization, and quickly identifies your specific skills and highlight your relevant experiences. A cover letter to market yourself as an APRN should be in one paragraph. They know the gist of what it is and why they should even turn the page. So I'm an experienced RN with 13 years of ICU critical care experience. I'm graduating with my acute or my adult gerontological acute nurse practitioner degree, and I'm planning on certifying with blah, 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 blah. I have been skilled in my training with procedures. My clinical rotations have included simulation at my program along with critical care, ICU, ER, whatever experiences. I'm a fast learner, yada, yada, yada. I look forward to speaking to you more of your position, right? So in one paragraph, I should be able to identify why you should stand out from 20 applications on my desk. So communicating within a cover letter is something that you guys will talk about closer to graduation, okay? Even now, though, as a student, you guys can begin to start the networking progress too. So I'm kind of going back to that. Feel free to contact your state board of whatever, wherever you are. Do you have an NP board? Can you start attending conferences, meetings? Can you start putting yourself out there? It's number one, how you network. You need to be professional at all times, which you may absolutely find yourself landing a job opportunity you wouldn't have found any other way. Also, many of your national APRN organization, NP, CNS, will have career assistance or opportunities to get feedback of that as well. So you have lots of opportunities out there. There are places that have salary surveys and some of those things to kind of know, am I getting in the ballpark of what I should or shouldn't be paid? Those are things that are very helpful. In your readings, they talked about the different associations. So there's the AANP, American Association of Nurse Practitioners, the National Association of CNSs. All of those people are out there. And again, beginning to be professional at all times. Over 85% of employers are saying that they view their online profiles before they hire anybody. Thus, you as an APRN student are advised to review your personal social media to ensure that contents, profiles, images, communication reflect your professional values as well. All profile pictures should be presentable and something that you would want to see. So again, this is in your text as well, but right now if your profile picture on some kind of social media is you taking a shot at a bar in your swim trunks or bikini, just think about it. Is that the professional picture that you would put on the front of a cover letter to go and get employment? And if not, then change it and consider doing that even now. Oh my gosh, sorry, excuse me. All right, your professional portfolio is an electronic presentation of your qualifications and accomplishments, and this is something you guys will talk about again, but I'm bringing it up now to consider things for you to have in the back of your mind. Any great, wonderful feedback you get from a preceptor, or at some point if your preceptor is ready to give you a reference or anything like that, that could be put in a portfolio. And if you present, if you get awards, if you're on scholarship, anything that shows, hey, I'm an excellent person, I'm an excellent student, those are things that can go in your professional portfolio. Your capstone project at the end of your time at Augie is something that could go in a portfolio. You could also have little things in there that say, I'm a CNS and this means this is my scope of practice and this is what the state of South Dakota says. I mean, any of those things that you can do to show why they should hire you. And then they talk a little bit about your resume or CV as well. And so those are things that would be in your portfolio. In the reading, it talked about your curriculum vitae, your biographic sketch and a professional introduction, your clinical practica and practicum experiences. So you would be putting in something like that, like I've done 380 hours with this group of inpatient hospitalists or something like that. Pertinent statutes and regulations, scholarly work, color copies of your professional licenses and registration, and those things would be something that you put into your professional portfolio. You're going to build a resume and a curriculum vitae, which will be concise, which will be something that the employer will review. A resume is more concise. A curriculum vitae is longer and is used for academic positions. I have one of each. My resume is 2 pages. My CV is about 20. So you will talk more about this as we talk about closer to graduation and what that looks like, but begin to kind of think of these things in your brain and maybe talk about it with your preceptor. The interview process. There are many types of job interviews. Some people are online, some are via the phone, some people obviously are in person. This is a chance for them to get to know you as a person and a prospective employee, be empowered to interview employer as well and ask questions. So we get so focused as they are interviewing me, and I would definitely encourage you to keep it in the back of your brain that you are interviewing them, right? So why should I come work for you? What are you going to provide for me that would lead me to choose you, right? And this is a hard perspective sometimes to have because we don't always get trained well in doing this. We're going to talk about this further closer to graduation of interview questions, samples, practice. You're going to have the opportunity to practice interviewing and to, just practice talking it out loud. And then, of course, you may have to very clearly be able to justify or articulate or demonstrate why you will bring value as an APR and that they understand what it is that you also bring to the table. Sometimes people have interview questions for you that are like, why should we hire you? Tell me about yourself. Tell me about a time you disagreed with a physician. Tell me about a time when You said something that ended up having a negative impact. Tell me about a time that you had a conflict with the patient and how you resolved it. These are all things that we will practice with you as you get towards the interview time. And then we'll talk about things that you can ask them too, like how is productivity measured in this setting? What am I expected to do? Am I based on, is my salary, would it be based on productivity or am I at based salary? What kind of EMR do you have? Will I have on-call or after-hours responsibilities? What kind of training or mentorship do you provide? How long does your credentialing and privileging take? What is my reporting structure? Will I have staff to be supported to support me? How do I do my billing? Are you going to be marketing for me? Is there leadership opportunities? These are all these different things that we will also help guide you through as well. When we talk about negotiation and renegotiation, the initial interview is time to gather information about the organization. This box 18.7 are some of those questions I just talked about you. Oftentimes, negotiation is informal at first, and you are kind of talking about generalizations, right? And then you can get a formal letter or even a contract of what they are offering you, and that is the formal contract. There's two aspects to negotiate, and to begin with the most important, right? So what are they talking about here? Once your formal offer is written, you should take that agreed upon time to consider all aspects of the offer, paying close attention to the concerning clauses. So you should say, I'm going to need a week or 2 weeks or whatever you think you're going to need. You don't ever accept right away would be my advice. You always say, okay, I'm going to take time to review this offer. Okay. When negotiating points for a contract, you should provide a brief rationale for the request, explaining that you're going to want to understand the offer and do not be apologetic. A period of residency or novice or transition is one potential area for negotiation because as a new clinician moving into a new clinical area, it is likely that productivity as defined by the employer will be lower within that built-in time frame that you're going to need to orient to the organization and to be a novice in your new position. Negotiating ongoing expert clinical mentorship and possibly a reduced workload for a defined period of time is very reasonable, and it's an important request to consider, with evidence suggesting optimal transition to the new role would be requiring some of these reduced workloads. There's some good exemplars that you guys had in your reading as well, so I'm not going to continue to go about that. In your consideration of the contract then is benefits and bonuses. Definitely, obviously, your salary is huge. Remember that the salary and compensation package can include your benefits that can add a value of 30 to 40% of your salary. Some employers may base the salary in a pay range developed by the organization based upon your years of experience as a nurse, and some may be hourly or salary. APRN should be familiar with what you feel like your local area hourly wage or salary should be. Some contracts can offer bonuses or ways to have bonuses based on quality or productivity or profit sharing or satisfaction of patient scores. If there is a bonus in your employment contract, you have to make sure you understand how that bonus is calculated, realized, and paid. And there's some great reading on that in your book as well. Finding yourself a mentor, such as your preceptor, can really help place a dollar value or can help you market and negotiate for yourself. If you find yourself in a really complicated employment contract, they do talk about whether or not there's benefit of having a lawyer or attorney review. Some people would argue that the negotiation of the terms of a contract is common and considered professional imperative. There are things that you have to pay attention to, such as your scope of service, on-call requirements. Are there any additional responsibilities, administrative responsibilities? How long is the contract for? How are you reviewed? Do you have a bonus structure? Is there raises? How does the compensation work? What are the benefits and what is the malpractice coverage? Is there any collaboration or supervision built into this? Is there offering for mentorship or support? Is there restrictions on outside professional activities? What's the termination clause? Is there a non-compete clause? And those are things like saying that if you end your if you quit, you cannot work within a 90-mile radius of a similar position for 1 year. There's some craziness out there with these clauses that I had never heard about as an RN, but definitely now am familiar with as an APRN. If you decide to be an independent contractor, this is oftentimes in like the nurse midwife or nurse anesthetist role. Sometimes NPs do it. I don't think this is as common for a CNS. You have to be realizing you're considering to be self-employed. You have to then really negotiate what your contract looks like, how your fees work, and how that works with state and federal taxes, etc. Practice agreements is saying how are you going to function within that job, right? Never, ever assume that your employer truly understands your state board of nursing and what it is that you can and can't do. This is something you need to be able to be very clear and articulate on. Provide employers with documents pertaining to your state board of nursing laws, and interview person overseeing the position before accepting the offer. All right, malpractice insurance. Typically, as an APRN, your employer will pay for your malpractice insurance so long as you're not an independent contractor. There's two types of policies: claims made and occurrence. Claims made only covers claims made during active policy period if the claim is also made during active policy period. So in other words, if someone files malpractice against you and you have claims made, that is only covered if you're still employed with them when the claim is made. So if you have a claims made only, so if you cared for a patient in February and then you quit in April and they don't decide to sue you until November, if you only had claims made, you would not have malpractice coverage because you're no longer employed. So then they talk about tail coverage, which is where you then buy that policy for like 2 years to cover you during the time that someone could sue you for during your time of that employment to be covered, okay? Occurrence coverage means it will cover any malpractice claim that occurred during the period you were employed, no matter when the claim is actually reported. So if you take care of a patient in February, you quit in April, and in November they sue you for the February claim, you're covered, even though you're not employed by them anymore because it occurred during the time you were employed by them. Obviously, occurrence policy is much better and what you should always advocate for. I have had a series of jobs where it was weird that they actually offered me claims made coverage and then also had a built-in rider of providing me 18 months of tail coverage if and when I left. And it was always explained to me that that is just the way that their malpractice people write it as a different thing and however. But so it was essentially occurrence coverage, but it was broken into two pieces. I found it very confusing. I ended up having the attorney review it and it was fine. I was covered all the way. You do not want to find yourself in a position where you don't have malpractice coverage for an event. That would be bad. If you're an independent contractor, you will be purchasing your own individual malpractice insurance, and you need to really consider that because sometimes rates are kind of crazy depending on what you're trying to do. You also have to be familiar with statutory requirements for coverage, meaning states can mandate that you have to have a minimum of, for example, $1 million malpractice coverage, right? One state may say you have to have a $2 million minimum. Whatever their state regulation is, you have to make sure your company follows that. So for an example, if you're working for a company based out of Texas And in Texas, you have to have $1 million, but in your state, you have to have two. You'd have to know that and say, you need to cover me for two, because otherwise I won't be within compliance. And they should help you with that when you're doing those jobs. Those are things that they should know, but you are also the main person to know how to cover yourself appropriately. I wanted to point out the exemplar 18.3 in your reading, detrimental clauses in APRN contracts that should not have been signed. So one of them is a computer license fee that the example was the employer would guarantee the fee for the computer software will be forgiven after 3 years, but if you quit, then you have to cover the prorated costs. Bad. The covenant not to compete, one is on there, and the salary that says the salary is $50 per hour based on productivity of seeing 40 patients in an 8-hour day. Productivity will be reviewed on a monthly basis and adjusted accordingly. So there's a number of issues with this clause, including a requirement to see 5 patients per hour or 1 patient every 12 minutes with a total lack of specificity. What if the patients don't show up for the appointment or they cancel? What if it's unsafe? What if you're putting yourself in a malpractice environment? So there's things in there that you kind of have to know, and you have to kind of be nitpicky of considering how could they use this against me to put me in a bad position. So it's a little tough. All right, the next thing we talk about quickly in marketing is overcoming invisibility. Demonstrate unique value to the organization. Your APRN role may often be invisible to external funding agencies and marketing services within the organization or practice, right? So we've talked a little bit about that previously. There are a number of situations in which an APRN is made invisible. One is that you're only allowed to bill incident 2, right? Others could be that you're not allowed to bill or code for things and that you just get absorbed and no one's ever going to be able to come back and say, well, what contribution did Sarah actually make? Because you're just kind of there and you're never allowed to bill or charge or be recognized for things. And you will help keep yourself from becoming invisible when you can articulate for your full scope of practice and be able to fight for doing what you need to be doing. So we very quickly ran through this, but marketing is something that you will need to think about and to know about. We bring this up now, not because I'm going to test you on this or anything, but I want you to have these ideas in the back of your mind as you continue this next year of your program, things to start thinking about, talking about, asking your preceptors or other places. And certainly if you're already having discussions about or thinking about what kind of job you may or may not want, these are things to start to be thinking on.